50,000 COVID-19 vaccines will be in Jamaica by Thursday. Minister of Health and Wellness, Dr. Christopher Tufton, says the arrival of the vaccines will trigger the National Interim Vaccine Deployment Plan. Dr. Tufton and Permanent Secretary for the Health Ministry, Dunstan Bryan, shared details in a virtual COVID-19 press briefing on Tuesday. Minister of Health and Wellness, Dr. Christopher Tufton, says 250,000 individuals are included in the first set to be vaccinated.
Priority categories are healthcare workers, government officials, the elderly, 60 years and over, the Jamaica Defense Force, the Jamaica Constabulary Force, the Jamaica Customs Agency, the Jamaica Fire Brigade, Passport and Immigration Citizenship Agency, persons who work in elderly childhood, primary and secondary education institutions, and there is a select group of government workers that are essential to the functioning of the economy that will also be a part of that initial group based on the role they play in interacting with the public and providing critical services.
Permanent Secretary for the Health Ministry, Dunstan Bryan, says vaccination lists will be prioritized.
Older healthcare workers will be prioritized over younger healthcare workers. Healthcare workers with comorbidities will be prioritized over healthcare workers without comorbidities. Healthcare workers in high exposure areas, so for example, healthcare workers who work directly on the COVID ward or in A&E, will be prioritized over other healthcare workers that are not in those high exposure areas.
He says several types of vaccines are being procured, including Moderna, AstraZeneca, and Johnson & Johnson. Viewers were informed that the vaccines will be distributed at fixed and mobile sites. Mr. Bryan says Phase 2 will include public sector workers.
Hotel workers, transportation sector, manufacturing sector, banking sector, the agricultural sector. The principle behind Phase 1 is that we are looking at the vulnerable groups, the persons who are in high contact areas or are coming into high risk for contamination. We're looking at the persons who are highly vulnerable for negative outcome from infection. And so that is what underpins our Phase 1 implementation. Our Phase 2 implementation are those persons within the economy or the society that are essential to economic activity. And so we look at the different economic groups and we will be prioritizing those persons. And then our third phase is a general population phase that looks at those persons in the general population who require vaccination.
The Permanent Secretary says Phase 3 will include the general population. Based on the group in which they fall, Jamaicans will get information and set vaccination appointments via call centers, parish health departments, websites, and walk-ins.
If you wish to get an appointment, you must start the appointment process 5 days before you want your actual appointment. And when you ask for your appointment, you have to provide certain information: your age, date of birth, your area of work, comorbidity, your allergies, your address, the venue that you wish to be vaccinated at, your telephone number and email.
He says notification on vaccination dates will be sent 3 days after the appointment is set.
Once that is done and you have done the vaccination, a second appointment will be made for your second dose. And as you know, most of the vaccines that we are getting are 2-dose vaccines, and therefore majority of persons will be required to take 2 doses, and so you will have to run this process twice.
He explains what happens at vaccination centers.
Our vaccination centers has 5 stages: registration, counseling, vaccine administration, observation, and documentation.
Mr. Bryan says the aim is to vaccinate 1,000 people per day.
5 registration desks. They will have 5 registrations counseling centers, 34 vaccinators with a throughput of 6 vaccines administered per hour for 5 hours, which gives us our 1,000 vaccines per day. There will be 5 observation centers and 5 documentation centers where your vaccination card will be provided to you at the end of the process, and your second dose appointment will be made.
The second dose of the vaccine should begin in May, and the third phase of vaccination will begin in March 2022.